Good evening. On behalf of the City of Gloucester Health Department, I would like to welcome everyone here tonight to hear Dr. Jody Gilman present a talk entitled Cannabis Use and Youth: Impact on Brain, Mental Health, and Academic Performance. Before I introduce our speaker, I would like to say a few words about our goals in addressing the issues of prevention and harm reduction around cannabis, alcohol, and other substance use, especially how it impacts young people. One way the Gloucester Health Department is addressing these issues is by promoting the Talk They Hear You campaign, which is part of SAMHSA, the Federal Substance Abuse Mental Health Services Administration. This campaign focuses on the importance of talking with teens and young people about the risks of underage drinking, as well as cannabis and other substance use. Research shows that over 80% of young people say their parents are the leading influence on their decision whether to drink or not. We currently have large Talk They Hear You PSAs on 4 CADA buses, one of which is in Spanish, and starting in December, we will have Talk They Hear You PSAs on 120 shopping carts in the Thatcher Road Stop and Shop in Gloucester. In addition, we have pocket-sized brochures entitled 5 Conversation Goals, talking with teens about alcohol and other drugs. If any parents or adults are interested in joining our local Talk They Hear You campaign to promote ongoing conversations with young people about the risks of substance use, please feel free to put your contact information on our Talk They Hear You Parents Night Out sign-up sheets. Dr. Gilman will talk about how cannabis affects young people's brain development and other consequences that can cause very serious harm. I want to specifically mention one aspect of cannabis use that has devastating short-term consequences, and that is driving while impaired from cannabis. It puts all of our lives at risk of death and injury every time we get into a car, either as a driver or a passenger. It is wishful thinking to believe that when it comes to driving, cannabis is a safe alternative to alcohol. It isn't, because cannabis slows reaction time, impairs short-term memory, coordination, and judgment. I believe that in many cases, it can be more dangerous to drive while impaired by cannabis than alcohol because of the inability to accurately estimate the dosage and effect of cannabis. With alcohol, many people know how 2 beers or 2 glasses of wine will affect them. Not so with cannabis, as the THC levels can vary widely as the manner it is used, either smoked or eaten. We love our freedom to travel in cars, but it's time to be honest about wasted driving and treat it just as seriously as drunk driving. And now it is my pleasure to introduce Dr. Jody Gilman, who is an associate professor in psychiatry at Harvard Medical School and the director of neuroscience at the Massachusetts General Hospital Center for Addiction Medicine. Thank you.
Thank you. Thanks so much for coming. We have a small crowd here, which is totally fine. So this can be interactive. So if I'm saying something, you have questions, just raise your hand. This can be more of a discussion. It's not like there's 100 people and we have to wait till the end for questions. So I'm happy to take questions as we go along. So I'm going to start with my punchline. I'm not a comedian. I don't have to give a long story. And my punchline is that cannabis is failing to deliver the benefits that people were hoping for. And really because of marketing and the media, I think that people had hoped that cannabis would be this cure-all. That is fun, and it helps people relax, and it helps people sleep, and it has none of the bad effects associated with alcohol or tobacco. It's just something that we can do for fun with no harm. But in reality, data is coming out of recent studies showing that there are well-documented harms of cannabis use and limited benefit. Okay, so let me give you an overview of what I'm going to talk about. I'm going to talk to you about cannabis and cognition in adolescents and young adults. I'll share some survey data we've done. I'll show you some graphs, nothing too out there. I'll make sure to explain everything fully. I'll talk about some laboratory studies where we looked at risk-taking, learning, and memory. And I'll talk about a randomized clinical trial looking at memory and mental health in cannabis. And then I'll talk about cannabis use disorder and why it matters. And cannabis use disorder is like every other addictive substance. Cannabis is no different than other addictive substances. mythology is out there that it's not addictive. I don't know where it came from. It makes no sense. It's a psychoactive drug. It is certainly addictive. And when people do become addicted, they can have symptoms of this cannabis use disorder, which I'll talk about. Okay, let's start with some background information. So cannabis is the third most commonly used drug in the United States after alcohol and nicotine, although a study just came out in New York saying that cannabis surpassed alcohol, which I was really surprised about. But nationally, it's the third most used psychoactive substance. Over 100 million Americans have used it. Regular use is most common in young people. So in 2022, the last year that we have data, 8.3% of 8th graders, almost 20% of 10th graders, and over 30% of 12th graders used cannabis in the past year. So it is widely used among kids. And there has become greater acceptance of cannabis in the US, reflected in legalization. So young people are the most supportive of cannabis legalization. 36% of teens think cannabis is harmless. 43% favor legalization. 24 states and DC have legal cannabis for recreational use, and cannabis has been legalized as medicine, and I put medicine in quotes, and I'll tell you why, in 39 states plus DC. I have to update this slide constantly because legalization is spreading. And I was telling some people before this talk, there's no going back. It's here. There are dispensaries everywhere. There's a bunch in Rockport. There are a bunch even near my hospital, MGH, and it was something that we're going to have to learn to live with. So in the meantime, cannabis products have changed dramatically. People have used cannabis for thousands of years. That's what I hear. People have used cannabis for thousands of years. It's, since the ancient times. But it had always been this flower-based product that contained low amounts of THC, which is the main psychoactive compound in cannabis that causes the high. In the cannabis plant, THC usually comprised 1 to 3% of the chemical compounds in the plant. And that is what people voted to legalize. People went to the polls thinking this is what they were going to get. Oh, I'll get a little high. In the meantime, with commercialization has come highly potent products. So generally in the scientific field, low potency THC is considered under 10% THC, and high potency THC is considered over 10% THC. And that tiny little blue sliver is THC below 10%. So what does that mean? That means that basically low THC products have been virtually eliminated from the marketplace. You just can't find them anymore. We don't have these flower-based joints. These are the products we have today. This one looks like a highlighter. What do you think happens? Kids take it to school. You can have THC oil in it. You have all these vape pens. This looks like a USB. You can put it under your sleeve. You can go like this during the day. You have, edibles that look just like a cookie that you have in your lunchbox. So kids can use these products in school all day. Nobody knows. When I was in high school, you had to sneak out of school and go to the smoking corner. You don't have to do that anymore. Because of these new products, this has just dramatically changed the landscape of cannabis use in our schools. And the other thing is that these new cannabis products, not only are they hard to detect, but they are very highly potent. They contain very high amounts of THC. And again, that's, going back to these products, waxes, hash oil, capsules, butters, shatters, these things can contain up to 98% THC. So we're talking about a completely different product. That's not even to mention this new market of edibles, which, let me tell you something, they're being marketed to kids. These aren't being marketed towards adults. Some adults eat gummy bears, but mostly kids eat gummy bears. So I think these edibles are really specifically being marketed towards children. Why does it matter? So this is a little busy, but I'll tell you the main points of this graph. So this is a graph looking at rates of psychosis. Psychosis is a precursor to schizophrenia. And one of the most devastating consequences of cannabis use is the development of schizophrenia. There has been decades of research linking use of cannabis to development of schizophrenia. And this was a study that was done in Europe where they looked at people who never used low amounts of THC once a week or less than once a week, or daily, low amounts of THC versus daily high amounts of THC. And the bars I want you to look at are these green bars. These green bars, and this was done throughout Europe, are the odds ratios of the people who are using daily use of THC greater than 10%. So these people who are using high potency THC daily were 5 times more likely to develop a psychotic disorder compared to non-users, and almost 9 to 10 times more likely in Amsterdam of developing psychosis compared to non-users. So what is this telling you? This is telling you that these high THC products can be harmful to a subset of people. Not everyone. Schizophrenia is a rare outcome. And an argument is that, well, if cannabis causes schizophrenia, then why don't we have like super high rates of schizophrenia? But we think there's an interaction between genetically vulnerable people and cannabis that can spur this illness.
Is that the only connection, a possibility of genetic connection?
So it's a really active field of research. What we think is that there are some people who are vulnerable to developing psychosis through a variety of factors. One is genetic factors. Another is life factors, trauma, different exposures in childhood. But cannabis, even controlling for other factors, still predicts development of psychosis above and beyond these other factors. So there is this link between cannabis and psychosis that can't be explained away with other factors. So I think that this is very relevant to the schools because cannabis is especially harmful to the adolescent brain. Why is that? It's because adolescence is a uniquely vulnerable time where the effects of cannabis are magnified. Cannabis is more addictive in kids, and cognitive effects are worse in kids than in adults who use cannabis because the brain is still developing at this point in the human lifespan. During adolescence, the brain undergoes structural and functional changes, and one of the most notable changes is in gray matter. That's your neurons and the development of your neurons. And what you can see is that throughout adolescence, gray matter is decreasing. So particularly in the prefrontal cortex, you see this decrease in gray matter, and that's a good thing. That means that we're eliminating the unneeded connections and strengthening important neural connections, eliminating less useful ones. And these changes in gray matter during adolescence are linked to improvements in cognitive abilities, working memory, processing speed, and so forth. And cannabis is thought to interfere with these processes. These binding sites are where THC binds in the brain. And as you can see, this whole brain is, basically very important in our functioning. There's a broad distribution of these cannabinoid receptors in areas such as the basal ganglia and the amygdala and the hippocampus and the neocortex. These are areas that are involved in motor control and planning, anxiety, emotion, fear, cognition, memory, and motor coordination. So THC is binding to these sites in the brain that are very important in our functional outcomes. And that's why effects of THC are so broad. The effects of acute THC intoxication affect all of these processes. Does anyone have any questions so far before I go into some of our data? Yeah?
Those binding sites, are those similar in what other substances are, like for opioids?
So it depends on the drug, of course. Alcohol there's no alcohol receptor in the brain. So alcohol affects the brain through different neurotransmitter systems. But THC, so we have an endogenous endocannabinoid system in the brain. So there are actual receptors that THC binds to because we have something called anandamide, which is a naturally occurring cannabinoid that's very important in brain growth and development. So THC is unique in that there is this receptor in the brain that it can bind to. There are opioid receptors in the brain also, and there are endogenous opioids too that bind to similar parts of the brain. But it really does depend a lot on the drug that we're talking about. But it's a good question. So let me get into some data we've collected on the effects of cannabis on mental health, social cognition, and memory. And I'm going to start with some survey data. So I have a colleague who surveyed kids in 60 middle schools and high schools across Massachusetts, ages 14 to 19. And she asked about use of all substances, cannabis, alcohol, and nicotine, and looked at mental health outcomes, suicidal thoughts and behaviors, depression and anxiety, psychotic experience, and ADHD symptoms. And I'm going to show you some of this data. Okay. So what I have at the bottom of this graph is how often these kids reported using these substances from never, ever, monthly, weekly, and daily. And this is the percentage of kids that endorse the symptoms she was asking about. So this is suicidal thoughts, and this is depression and anxiety. This was a scale we used. And let's start with alcohol. So what you can see with alcohol is that there's this dose-dependent increase in suicidal thoughts and depression and anxiety, where the more frequent they use, the worse they are. Now, this orange is nicotine, and you see the same pattern. You see the kids who use more nicotine report higher suicidal thoughts, more depression and anxiety, particularly daily users. Now, for cannabis, interestingly, cannabis is no different. Let's take a moment to process what this means. Compared to kids who don't use drugs, never, suicidal thoughts increase 5-fold in kids who use substances daily. In fact, 1 in 2 kids, 50%, who use these substances on a weekly or daily basis will experience suicidal thoughts. So for people working in the schools, what this means is that these kids who are caught using cannabis are also struggling with other mental health issues. And historically, kids caught using drugs have been alienated or disciplined or even expelled from school. But what this data suggests is that these kids need more support, that these kids who are using these drugs just aren't doing well mentally. We see the same trend in a national survey called the Youth Risk Behavior Survey. So it's not just happening in Massachusetts. It's not that there's something going on with our Massachusetts students. These patterns are also can be seen in national data, where higher suicidal thoughts, more mental health, more substance use of all substances, including cannabis.
Question.
Yes.
On the, what is that, the x-axis, I think.
Yeah.
After never, in between never and monthly, does that, it says ever for the label. Does that
Past
mean
year.
like every once in a while?
Yeah,
or-
past year. We say have you used in the past year.
Okay, have you ever, okay.
Yep.
Thank you.
And then monthly is have you used in the past month.
I
I
have a
gotcha.
question too. So, how do you know, or can you know, that kids who are having problems with suicidal thoughts, for example, are using drugs and alcohol to mitigate those thoughts?
Yep. Yep.
Is there a way to know? Or is it
Absolutely.
sort of vicious circle?
Absolutely. So what causes what is what you're getting at. Survey data can't really show you that. Because even if they, you'd have to survey them before they start using. So you have to start surveying them in childhood. And there are studies that are doing that. But that's not what we did in this study. But I think in some ways it matters scientifically. But when this kid is in your office, it doesn't really matter. It doesn't matter if the drugs caused the suicidal behaviors or the suicidal behaviors were there and are causing them to use drugs. I think that the point of this data is just showing that these kids using drugs are struggling with other things. Of course, scientifically, we do want to know that, and there are studies underway to figure that out. So these data are interesting. So here I showed you that cannabis is no different than other substances that we teach our kids to avoid. Smoking is bad. Cigarettes will kill you. Oh, go for it.
Sorry.
For it. Yep. Sorry, I can't see you. There's a pole.
These participants,
Mhm.
is it like yes, no, like yes they use a substance, or yes they use cannabis, or no, or is it like they only use alcohol?
Oh, no. That is another point. I'm really glad you asked this question. Polydrug use is really common among daily users. So among the ones who don't use that much, sometimes they only use alcohol or they only use cannabis, but the ones using more frequently use everything. And we see this over and over again. And I think with legalization, there was a substitution hypothesis. Cannabis isn't as bad as alcohol, so let's let them use cannabis, and then they won't use alcohol. And then they won't get into fights, and they won't, drive drunk because they'll be using cannabis. It doesn't work that way. They just use them both. They use them both together. They use them both concurrently. There's very little evidence for any substitution effects in our data. So this is interesting because what I showed you was that really the mental health effects are identical between cannabis, alcohol, tobacco, but perception of safety of cannabis is high. And that's what this graph shows. So this graph shows that since 2006, people who say that using cannabis poses minimal or no risk has doubled, whereas all the other substances have stayed the same. So over half of people surveyed say that cannabis causes no or minimal risk. And I think that's just really nice, lobbying by people who have a lot invested in selling these products, because it's just not true.
This is adults as well as children.
Yes, this is everybody. Yep. This is 12th graders. And this is, the other one was perceived safety, and that's why it was going up. This is perceived risk, and it's going down. So this is risk perception among 12th graders who are using regularly, using occasionally, or have used once or twice, and the risk perception is going down in these kids. So what do we have here? We know that they're associated with negative mental health effects, just like our other substances, but the perceived risk is a lot lower. The other thing that I want to talk about when you're talking about kids is the importance of the social environment in which adolescents are using cannabis. Adolescents are highly influenced by their social environment and peer groups. And the desire to fit in and peer pressure and exposure to the drug within their social circles can definitely increase the likelihood of experimentation with drugs. And what you see is that everything goes down in 2020. Does anyone remember what was happening in 2020? COVID. So these kids were kept away from their peers. They weren't going to school. They had to stay home. They couldn't go out. And we saw rates of drug use just plummet in 2020. They have since recovered. But I think this is important because, the take-home point here is that cannabis use is common. Cannabis use is associated with worsened mental health. Potency of cannabis is up. Potency of cannabis is associated with the development of psychosis. Risk perception is down. Risk perception is associated with increased use among everyone, but particularly adolescents, and social context matters. So that's what I've hopefully convinced you of so far. I know that's a lot, but you put all this stuff together and it's sort of this, perfect storm of what we're going to see with cannabis. Okay. What about risk-taking behavior? So as part of these studies, we also looked at risk-taking in these adolescents. And if you remember, the part of the adolescent brain that is still developing, the prefrontal cortex, is responsible for functions like decision-making and risk assessment and impulse control. So cannabis during this critical period can alter the maturation process of these functions. So risk-taking is a domain that we care very much about. So this was one of the studies that I did when I first went to MGH. I gave individuals this risk-taking scale where we looked at these domains of risk: social risk, which is like disagreeing with a parent, wearing unconventional clothing, recreational risk, bungee jumping, skiing, financial risk, investing and gambling, health or safety risk, unprotected sex, riding a bike without a helmet, or ethical risk, shoplifting, cheating on an exam, and so forth. These are some examples of questions. And I gave this survey to kids who were using cannabis and kids who weren't using cannabis. And let me show you what I found. So the kids using cannabis are in the black. The kids who are controls, not using cannabis, are in the gray. And what you can see is that the kids who used cannabis scored higher on social, health-related, and ethical risk-taking. Thinking back to our earlier data on mental health outcomes, this graph indicates that kids who use cannabis might not only have more mental health symptoms like depression, but may be more impulsive, may be more likely to engage in health-compromising risk-taking behaviors that are likely to have impact on their functioning. They may be more likely to have unprotected sex or challenge authority, and for those working in schools, these are things that you might want to talk to these kids about. These domains can be explored in universal prevention programs or targeted interventions. These risk behaviors extend to driving. So like Daniel talked about in the beginning, cannabis does not make you a better driver. No matter what people tell you, it is just not true. Cannabis has effects on brain regions underlying motor control, planning, attention, and at least doubles the risk of fatal motor vehicle accidents. And yet, in 2018, over 10% of young adults reported using cannabis while driving. And the highest proportion of people using cannabis while driving were these 21 to 25-year-olds. And they just, and the second highest group were the 16 to 20-year-olds who barely know how to drive. So kids are using cannabis while driving. They think it's not affecting them, but we know it is. So that's something that I think we can do a better job of. We've done a good job conveying danger of driving while impaired from alcohol. We have programs that provide kids with safe ride homes, but there are few programs like that for cannabis. So far, I've talked about functioning of kids in non-academic domains. But now I'm going to tell you about some studies that we've done looking at how kids learn. And the most common cognitive deficit associated with cannabis use is poor memory. We see that over and over again in a lot of studies, and that can have functional outcomes on school performance. So in the next study I'll present, we brought college students into the lab who either used cannabis but started later, used cannabis but started earlier, or didn't use cannabis, and we gave them a memory test. And I'm going to tell you a little bit about this test. It was a very tedious test for the kids, I admit. We read aloud a list of 16 words, and the participants had to read it back to us. We read the list aloud again, same 16 words, and they had to read it back to us again. And we did that 5 times. Then there was a delay. We read them the list of 16 words again, and they had to relay it back to us. And this graph shows the result of the memory test. So this is the number of words recalled. These are the trials. The more you read the list, the more they remember. That's good. So they are learning. But this graph, these red dots, are the kids who started using cannabis before the age of 16. And what you can see is that they performed worse on all of the trials than either kids who started using later or non-users. And it wasn't a problem with memory per se. It wasn't like after the delay they weren't remembering as much. It was a problem with initial learning. They weren't ever absorbing the information. So even on the first trial, they were behind, and that stayed throughout the entire study, where they just couldn't remember these words like the kids who weren't using cannabis. And when we actually looked at the words, and it was a lot of work to do this, but we actually looked at the words that they recalled. You present the words in a disorganized way, but like the person doing the study can categorize the words. They can make these internal categories to help them remember. And we found that while the people who weren't using cannabis were organizing the words into categories and using structure, the kids using cannabis showed no strategy or structure to organize the information. And therefore, their learning was more inefficient. So thinking back to the classroom, this could indicate that these kids might need help coming up with themes and organizing information. And it's really, it is affecting their ability to organize new information in a meaningful way. Yes?
So kind of similar to my last question about whether these are, like, if the use of cannabis can be isolated to just cannabis, or
Yeah.
if it's like a polysubstance use like alcohol and other things that often go hand in hand
Yeah.
with cannabis use.
Yeah.
Can that be explained away through this research?
Yeah, so you don't see the same things with alcohol as you see with cannabis. You see other things. So people will ask me that, well, isn't alcohol worse? And it's like, well, it's really hard to say because alcohol has a lot of negative effects. It doesn't affect learning and memory in the same way. So memory seems to be very specific to cannabis. And it could have to do with the binding sites in the brain that these cannabinoid receptors underlie. But we don't see the same deficits in this memory domain with other drugs as we see with cannabis. So I don't think it can be explained away by other drugs. That's a good question.
So the participants, it was just cannabis.
Yes. So they did use alcohol occasionally, but their primary drug of choice was cannabis in these studies. So remember from our survey data that kids using cannabis have high rates of depressive symptoms. So in this study, we brought in participants with either cannabis use, either nothing, cannabis use, depression, or cannabis use and depression. And we did this memory test with them. And what you can see from this graph is that the controls did the best. This is total number of words recalled. The kids using cannabis did slightly worse. The kids who had depression did slightly worse as well, and this looks different, but it actually wasn't statistically different. But the kids with both depression and cannabis use did significantly worse amongst all the groups. And we had delayed, like we read the list of words, then we waited 20 minutes, and then we had them repeat the list of words again. And after the delay, a short and a long delay, you really saw this difference in the kids with comorbid psychiatric diagnoses and cannabis. So what does this mean? Now cannabis is thought of as some people think it helps depression. It's a treatment for depression. Not only is there no evidence that it's a treatment for depression, but cognitively, it seems to be contraindicated for depression. It seems like these kids will take a double hit. So far, I've shown you this connection between more cannabis use and worse outcomes, worse mental health, worse cognition, greater risk-taking. The question that we really want to know is why. So one possibility is causation. Cannabis contains these psychoactive compounds, primarily THC, which alters the normal functioning of the brain. So cannabis is causing these outcomes. Another possibility is, it's a correlation. It just happens to be that these things occur together. There could be third variables, or what we call confounders, that influence both cannabis use and outcomes. Kids who are already struggling tend to use cannabis more. It might be a coincidence. And we have this directionality problem. So are individuals with poor mental health or memory problems more likely to use cannabis, or the other way around? So you can study this with animal studies, where you can actually administer THC to mice and rats, and you can see the effects on cognition. I'm not going to present that here in a community audience. I'll lose you all, and also it's not what I do. But we have done these animal studies, and we being the scientific community, and have shown that if you administer THC to adolescent rats, they do worse on these memory tests. But what we can do with humans is we can do these randomized trials of cannabis abstinence, and I'm going to tell you about one that we did. So this, again, was spearheaded by my colleague Randy Schuster in 85 high school and college students ages 16 to 25 who used cannabis weekly or more. And this was a randomized trial where we assigned them to be abstinent or not to change their behavior. We didn't say go use cannabis, but they were already cannabis users. So we said, you don't have to change your behavior. You can participate in the study. And the other group, we paid them to be abstinent. So we gave them money for negative urine screens for a month, for 4 weeks. So that's called a randomized trial, where everybody comes into the study the same, and you randomize them to different conditions. What we used was something called contingency management, where you offer escalating payments for clean urines over time, for negative urines over time. And we measured changes in cognition and mental health among the kids who are abstinent versus the kids who continued use. We looked at cognition, we looked at mood, and we looked at sleep. We were primarily interested in cognition, but we heard people say, I use cannabis to help my mood or help me sleep. So we looked at those outcomes as well. So here are our results. First of all, kids will stop using cannabis if you pay them enough. 80% of these kids stopped using cannabis. This is carboxy-THC in urine. Don't worry about the numbers. What's important is that they went to basically 0 by 4 weeks. It takes that long to get out of your urine. And these were the kids with continuing use. This graph just shows our experiment worked. And most of these kids were able to stop if we paid them. So that was good for our study, good for these kids. Unfortunately, when we stopped the payments, most of them went back to using cannabis, but it wasn't a treatment study. It was a study to assess cognitive effects. So here are our cognitive results, which are very interesting. These are the scores on the y-axis, and the x-axis is week to week. When you repeat a test week to week, you expect people to improve and get better. It's just a practice effect. We had attention tasks, and that's what we saw. Both groups showed improvement over time, as we expected. Really nothing to say here. Our memory test showed something very different. These are the kids who were abstinent. You see a pretty sizable improvement at week 1. And then it sort of flattened out, but they were able to improve their performance by 1 week of stopping cannabis. The kids who continued using cannabis showed no benefits of practice. They did worse, and they continued to do worse. And this was a week. This was only a week of stopping using cannabis. So as cannabinoids were being cleared from the brain, they were doing better on these tasks. And that was really interesting to us, that the kids who were using cannabis just showed no improvement from repeat testing. Yes?
Is the Z-score, is that, what's the scale? Is it 0 to 1?
Yeah, so what we did was we basically took an average of the score. This is getting kind of into the weeds. But a z-score, you basically take the average and you set it to 0, and then you can look at standard deviations below or above the mean. So I'm happy to send you the paper if you want to know more about the data. But the take home is that this group improved pretty substantially, whereas the kids who continued using cannabis just didn't.
Does it matter how much people used at the beginning?
Yeah, so that's a good question.
How long?
Yeah, so these were young, they were pretty young, so nobody was using for, 30 years. But they were using, between daily, so more than weekly, some daily. And they were using for at least 6 months before the study, but probably not for years and years. So I would call them, pretty occasional to regular users of cannabis. Yes?
Predominantly like the same age, like it wasn't the 16-year-olds were the ones not using.
Yep. So age was a covariate. We didn't see differences across ages. So this 16 to 25-year-old, the brain development is still occurring in this age period. I would say earlier use is worse, no question. Earlier use is worse. I can say that with certainty. 16 is worse than 18 is worse than 20 is worse than 25. But there's no cutoff, right? There's no like, oh, if you wait till this age, it'll be just fine, which is it was a good question. Now, here's something interesting. A lot of kids said that they were using cannabis to manage their mood. So then you would expect if you're using cannabis to manage your mood and you take it away, your mood would worsen. But we actually see that it did not worsen. So it's a little hard to see, but the pink is the abstinent and the green are the ones who continued use. And their depression and anxiety was pretty stable throughout the trial. So it didn't get better when they stopped using, which we kind of were hoping it would, but it certainly didn't get worse. So I don't think that cannabis was helping their mood. I think they were pretty stable with or without the cannabis on board. So what are our take-home points? Our take-home points from this set of studies is that cannabis affects memory. Stopping cannabis improves memory. Stopping cannabis is not associated with worsened mood, despite what people might think. I didn't show you the sleep data. I'm sorry, I took that slide out for time purposes. But what we found for sleep is that there was a small disruption in sleep due to withdrawal effects in the first few nights after they stopped using, but it resolved after the first week of abstinence. So when people say cannabis is helping me with sleep, and this is a very active area of research, what we think is that it's not that cannabis is helping with sleep. It's that when you stop using, insomnia is a very common withdrawal symptom, and it goes away. So I think that if a kid tells you that, well, I can't sleep without it, you just have to say, just give it time. Give it a few days. First 2 nights are going to suck, but give it time and it will get better. So overall, I would say that quitting cannabis can have a lot of benefits, physically, psychologically, and they often manifest soon after cessation. It doesn't take that long. So I have probably 15 minutes left, which is perfect, and I'm going to talk a little bit about cannabis use disorder, which is what we really worry about in kids. So what is cannabis use disorder? There are 12 symptoms of cannabis use disorder, and it's no different than other substance use disorders like alcohol, like opioids, like nicotine. And 2 of these symptoms is considered a mild cannabis use disorder. So one is using cannabis more than intended. So I meant to use once this weekend, and I ended up using 5 times. Trying but failing to quit using cannabis. So I tried to stop, but I couldn't, and I ended up using it again. Spending a lot of time using cannabis, and I know that's a little subjective, but are they high a lot? Are they getting high every day? Are they high for hours? Craving, when they can't get cannabis, do they experience this craving or this intense desire for cannabis when they can't get it? Using cannabis despite causing problems at home, at school, at work. They're not doing as well in school. They're not, they're getting into arguments at home, but they keep using it. Continuing to use cannabis despite social or relationship problems. My girlfriend hates when I use cannabis, and it always causes fights, but I use it anyway. I don't care. Like, but cannabis is more important to me. Or, you know, I'm having fights with my friends because they say I smoke too much, but I keep smoking anyway. Giving up important activities in favor of using cannabis. So, you know, I was going to go play tennis. I ended up smoking with my friends and getting high, so I didn't end up playing tennis. Using cannabis in high-risk situations, such as while driving a car. Or it could be riding a bike, or it could be just any situation where you should not be using cannabis. Continuing to use cannabis despite physical or psychological problems. I see this one a lot. I use cannabis, sometimes it causes panic attacks. Well, how often? Probably once out of every 3 times I use it, I have a panic attack. Do you keep using it? Well, yeah. So using it despite problems that it's causing is a sign of cannabis use disorder. Needing to use more cannabis to get the same high you once did, so that's tolerance. So I used to be able to smoke a joint and I'd feel great. Now I have to smoke 2 to get that same feeling. So again, that's tolerance. And then withdrawal. If I don't use cannabis, I'm irritable, I can't sleep, I'm grouchy, I'm dysphoric. Any of these 2 would qualify as a mild cannabis use disorder. 4 or 5, 2 to 3 would be a mild cannabis use disorder. 4 to 5 would be a moderate cannabis use disorder. And 6 or more symptoms would be a severe cannabis use disorder. So if this is happening, that's when you may want to engage in professional help. So what can you do? What can you do if this is happening? Well, I'd like to talk to you. I mean, my kids are young, so it's easy for me to say all this, and we'll see when the time comes if I actually stick to this. But I would say, number 1, if you catch your kid using cannabis, if your kid is high, stay calm. Reacting with anger or panic would make your teen defensive. Take the time, gather your thoughts, aim for a calm and supportive tone. Gather information, be curious. Educate yourself about cannabis, its effects, its potential risks, particularly for teenagers. And understanding the science will help you have a more informed conversation with your teen. The thing that I think we did, years ago, which really damaged credibility, was the whole reefer madness. Cannabis will make you go out and kill someone. No, it won't. But it doesn't mean it's safe. So, these kids are smarter than you think. You can have a scientific discussion with them. You can talk to them about the developing brain. We have resources. Choose the right time. Not while they're high. Not when they come home reeking of pot. Go to bed. We'll talk about this tomorrow. So choose the right time, find a quiet, stress-free moment to talk to your teen, avoid confrontations when emotions are high, or if they are, if emotions are high or if they are high, not the right time. And again, express concern, not judgment. I think that goes a long way. I'm concerned about this. I think this is something we should talk about. This is why I'm concerned about this. It's harder now that cannabis is legal. It really is. Before you could say, don't use it, it's illegal. I don't want you to go to jail. Easy. Now cannabis is legal. They can buy it down the street. Now cannabis is medicine. Oh, I thought it was medicine. Doesn't it help with all these symptoms? Like, how can it be bad? Well, no, that's actually not true. Cannabis does have risks. It does have risks to teens, and it is unproven in a medicinal sense. It was voted into, medicinal cannabis was voted on a ballot or passed by legislatures. It was not passed through clinical trials like other medicines. So, clinicians and doctors are highly skeptical of medicinal effects. There may be medicinal effects, and I hope there are, and I'm very interested in those effects, but right now the evidence is really, really slim. Set clear boundaries. So even though you're expressing concern, not judgment, you can still set boundaries. You can still explain your expectations and the reasons behind them and make sure that they understand what those boundaries are. And again, discuss the risks, talk about short-term and long-term risks of cannabis use, offer support, and finally, seek professional help if needed. I should say finally, there's 2 more tips. Seek professional help if needed. If the use is frequent or problematic, reach out to a healthcare provider or an addiction specialist. There are groups for teens. There are resources in your schools. There are resources that your pediatrician can give you. You don't have to handle this on your own. This is a really tough thing to do. Encourage positive activities, have them get involved in activities that promote healthy lifestyles, sports, arts, clubs, social groups. Maybe they're using cannabis with their friends because they're bored. maybe they're just not engaged in the community. Maybe there's, something they can do that would excite them. And then finally, stay involved, open conversations, keep track of their activities. You are the parent. You want to give your kids their privacy. You want your kids to know that you respect their boundaries, but you are the parent. And I would say, keep track of their activities, their friends, what they're doing, where they are, and stay involved. And you are their, you're their greatest supporter. Kids do want to know what you think. They do want your approval. So I'm just going to end here. I think I'm good. Back, to the original punchline, and I hope I've convinced you of this through all the data I've shown you, that cannabis is really failing to deliver the benefits that people were hoping for, where, I think that they're, in the media and even amongst the public, there was sort of this hope that cannabis would be this magical substance that would be fun and harmless, and it can be an alternative to opioids. It could solve the opioid epidemic. It could be an alternative to alcohol. It could just be something that kids do with their friends without any consequences, and I think that's actually not what's happening. So I will end there and take questions. I know I threw a lot at you, so I'm happy to answer questions about any of these studies or anything else.
I have a question. So you talked about the increased use of cannabis amongst teens, and you had a list of reasons why that was the case. And one of them was social.
Yeah.
One of them was social, and that's kind of their peers are doing it. And I'm wondering, as use has gotten spread throughout society, how much do you think is kids modeling their parents, parents' friends, like alcohol? Yeah. And because that's obviously something that that's something that can be done about that. But I'm just curious if that's
totally. I gave this talk, so this is sort of a long story, but the NCAA, which is the college sports league, is considering not testing for cannabis anymore. And I gave a talk there, and I'm like, I don't know if you want to test it or not, but here's what we know about it. Here's what we know about cannabis and athletes. And a bunch of the coaches are just like, how can I tell them not to use cannabis? I use cannabis. We all use cannabis. And I'm like, okay, well, yes, then that is a bit problematic. So I think you're totally right. I think that if kids see their parents doing it, they think it's safe. But then again, we have a history of this with alcohol, with cigarettes. And, if you drink wine responsibly at dinner, you still might not want your teenager to do it. So I'm not going to talk in front of a group of adults and say, tell you what to do and say, this is terrible, stop doing it. If an adult, I don't care, if an adult wants to use cannabis occasionally, fine. They're not hurting anyone, they're not going out and driving, they can do what they want. But I still think you can set boundaries with your kids. And you can say, when you're my age, when you're 45, when you're 50, you can make that choice for yourself. But your brain is still developing, you're still in school, you're still learning. This is a very important time in your life where you're making really critical decisions, and it's not the right time for you to use. So I do think it's harder if the adults in their life use, but I still think, like alcohol, you can continue to set your boundaries. Any other questions? Yes.
You have a question? Kind of an observation, maybe a question. It seems like when you go back into the 70s and 80s, the laws about marijuana were so severe. People were getting locked up for small amounts or for many years for a few ounces or a few pounds. And back then, it was so much less potent than it is now. And I think so many people realized that wasn't right to put people in prison for years. Rockefeller, New York.
Totally.
But it seems like it's just gone to the other extreme. And we didn't realize what was going to happen. I mean, it was wrong to demonize it and put so many people in prison. But now we've kind of created this monster. Well, maybe that's the wrong word, but the perception of it being harmless
I agree.
is really dangerous.
So yes, and it's gotten conflated with liberal politics. You kind of sound like a curmudgeon when you're like, I don't favor legalization, right? We're like, I'm as progressive as they come. But I don't really like what we've done with commercialization. Legalization and commercialization are two different things, by the way. We can remove criminal penalties. Locking people up, some people would say, you should do that. But I think most people would agree that was a bad idea. We don't need to send people to jail for small amounts of marijuana. That's very different than creating a commercial market. And, where big money gets involved. And these companies will profit if more kids are addicted. This is capitalism. That's just true, that the way for these companies to make money is to addict kids, and they have lifelong users. You just can't deny that. So I think that if we can separate the commercial and the legal, and if we didn't have, a commercial market, and it was sort of like, well, we're going to remove criminal penalties, it would be, there'd always be marijuana use, but it would be black market, and people say, oh, it's better that it's regulated. No, the black market is thriving. The black market is absolutely thriving in California. It's, they're underselling the dispensaries. The dispensaries, it's a big mess. It's a huge mess. But use would be down, I think, without these pot shops on every corner. So I think you can separate criminal penalties and commercial markets, if that makes sense.
Do you think that that there's going to be a trend where people recognize that this stronger cannabis is going to be doing a lot more harm to young people in their studies, and that they're going to have worse outcomes, and that's going to kind of, that it's going to change, but perceptions are going to change, or what could be done to speed that up?
Yeah, so this is really, this actually is something that's frightening to me. We have no idea what these potent products are doing to teenage brains, because these are brand new products. These are products that have emerged in the last 5 years. I remember, I went to Amsterdam a decade ago, and they had coffee shops. Okay, so you'll know what I'm talking about. So 10 years ago, they had smoke shops, and you go to the bud tender, and you order what you want, and there's people smoking or whatever. I went there last year to give a talk, and now it is all edibles, 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 edibles. Every other storefront is edibles and candies and sodas, and this is in the past 5 years. So there is this new market of highly potent products, and we just have no idea what they're going to do to young brains. We haven't studied them. We haven't had time. So they were legalized before we had time to study them. And that to me, as a neuroscientist, is frightening. Yes?
Have you ever done any discussions at dispensaries for dispensary staff or leadership or holders?
No, but I'd be happy to. I don't know if they'd want me, but I'd be happy to. So we are studying medicinal properties of cannabis in my lab. We're looking at CBD, cannabidiol, for low back pain. We're using an FDA-approved medication called Epidiolex, which is a CBD-based medication. We're looking at it for neuroinflammation. So I'm not anti-cannabis. If there are medicinal indications, I'm super interested in those. I just think that the medical marijuana, as we've conceptualized it, as getting this card and going to dispensary and getting whatever you want, isn't how medicine is practiced. It's problematic. Yes?
Forgive me as I don't know the best way to say this or explain this question.
Sure.
But have you seen any statistics on youth in youth groups and abstaining from using substances?
Yeah, so that's an interesting question. So colleges have substance-free dorms. There are different groups that can take oaths against drug use and pacts against drug use. I think those are effective. It's hard to know if a kid goes to a substance-free dorm. Did their parents make them? Or, is this something that's important to them? And I think both exist. But I think peer groups are so important that being around pro-abstinent peers will make people way more likely to be abstinent. When people are in recovery for addiction, one of the main factors of relapse prevention is changing your social group, which is very hard to do. But when you drop your pro-drinking peers and you're around pro-abstinent peers, you are far more likely to stay abstinent. So I think youth groups, things like that, can be great tools.
Yeah, that was my actual next question, where We run a good amount of youth groups, I think, over 3. And we don't shoo away youth who use substances at all, really, because we have so many great youth who don't use substances. And we hope that they learn stuff in our youth group to better help themselves and grow as people. And I was wondering what your thoughts were on that, which clearly.
That's awesome.
Yeah.
That's awesome. If you have some kids in your youth groups who are using cannabis, but they're around all these really good role models.
Yeah.
Who are having, a lot of success and having fun and they don't need cannabis. I think that's awesome.
Yeah. I
think
mean,
it's
our prevention is taking them to do fun stuff.
Yeah.
And they're with us and not using. So.
Yeah. And I think a lot of these kids, so there's a whole field of neuroeconomics of drug use. And if these kids are in impoverished environments, nothing going on, no one's taking them hiking, no one's taking them to do art, drug use makes sense.
Yeah.
If you think about neuroeconomics, if these people's lives are really bad and they have nothing else going on, well, it is fun to use drugs, right? That's why we use drugs. And offering alternatives, I think, can be really powerful in those situations.
Yeah, my role as youth development coordinator regionally, and I was teen director at the YMCA in Gloucester.
Oh, cool.
Really, when I saw youth using, it was because they were bored.
Exactly.
They were sick
They
of
don't
it.
have something better to do.
Yeah.
I totally agree.
I saw a lot of benefits with having like youth groups and teen centers that would help.
Yeah, no,
Yeah.
I think that's awesome.
Yeah. Awesome.
Well, thank you so much. Oh, one more question.
Just quickly,
Sure.
where are youth now getting cannabis? You said there's still a black market.
Oh,
Are they
yeah.
having older kids buy it at the dispensary? Are they getting it out of their parents' cannabis?
All of the above.
Parents are buying it for them.
All of the above. Yes. All of the above. So there's a thriving black market. The black market has not gone anywhere. And I think there was a hope that, let's regulate it. Let's treat it like alcohol. But it's not like alcohol. We have a history of alcohol for hundreds of years. I mean, we had prohibition, but that was short-lived. But these black market forces, they're not going anywhere. They're not being put out of business because they're cheap. And I think it was sort of a fiction that we would get rid of drug dealers and we'd get rid of the black market by regulating. I think that hasn't really happened.
I think I saw in New York City there are like hundreds and hundreds
Yes.
of unlicensed
Yep.
dispensaries.
The Cannabis Control Commission in Massachusetts am I being filmed? Okay. Well, we could talk later. They've had a lot of problems this past year. You've probably read about it in the Globe. It's really hard. It's not like this is all functioning, wonderfully well. So I think it's tough. All right, last question.
So I just want to say, to piggyback on what David had said about our youth groups, is something that they identified in one of our groups is there's 3 billboards on the main drag in Gloucester, and they're all all cannabis ads.
Yeah.
And we thought it was really awesome that a group of girls, they all wrote letters to Happy Valley, which is the dispensary, to take
Oh,
it down.
awesome.
So it says, find your happy place, and they were like, they weren't about that, so I think that's really important.
That's great. That's great. But it's hard. I mean, we're making the mistakes of the tobacco industry. And we've learned nothing. Remember all these ads that the tobacco industry used to have on billboards and cartoon characters, and now, then we said, oh, this is illegal, you can't do this anymore. And now we're repeating it with cannabis, and it just doesn't make sense. Yes.
If I could just preach a little quickly.
Sure.
We've talked so much about our youth groups. Gloucester Youth Leadership Council, or RYPN on Facebook, Regional Youth Prevention Network. While this is being filmed, if any parents are out there looking for resources for their kids, they can reach out to all of us, and we'll be there to help.
That's great.
Yeah.
Visit our resource people on the way out.
Yeah.
That's great. That's awesome. Thank you so much. You guys are a great group. I hope.